Hi, Mr. Levin. My name's Alyssa. I'm going to be your physical therapist for today.
Okay.
I'm just going to ask you a couple of questions about the reason why you're here today.
Okay.
So, are you ready to begin? Okay. How old are you?
60 years old.
Okay. What do your daily activities consist of?
I like to watch TV.
Okay. Are you working at all?
I'm retired. I worked in the postal service for 4 years.
Oh, wow. Okay, great. What is your living environment like as far as your house?
I have a dog and a wife, and I just live on the first floor of my apartment.
Okay. Do you have any aides that come and
No.
do anything, any housekeeping? Do you have any assistive devices or anything that you use?
Cane sometimes when I walk the dog.
Okay. And could you go ahead and rate your general health status for me? And a 0 out of 10 scale, 0 being not so good, 10 being you feel great.
I'd say about 5.
Okay. Have you ever smoked or do you currently smoke?
I do smoke.
You do smoke. How long have you been smoking for?
I've been smoking for 20 years.
Okay. How often, or do you drink alcohol, excuse me?
Yes, I drink every day.
Every day? How many drinks per day would you say you have?
I only drink about one.
One drink a day? Okay. As far as medications, are you on any medications?
Yeah, I'm on medications for high cholesterol.
Okay. Do you know the name of the medication or?
Crestor. I think I'm on other medication for my diabetes as well as my my high cholesterol.
High cholesterol. Do you have high blood pressure at all?
Mm-hmm.
Okay. Are you taking medications for that?
Yes, I am.
Okay, good. Are you allergic to anything? There'll be times I'll probably use latex gloves. No? Okay. Would you like to describe to me any past medical history, surgeries you may have had?
I had a hip replacement in 2001.
Okay.
I had a knee replacement in 2009. And on the left, both on the left.
Okay. Have you ever had any previous wounds or other skin infections?
I had smallpox. Excuse me. I had chickenpox when I was when I was younger, and then I have shingles currently, and I'm being treated for it.
Okay, great. What is your current condition? Could you please explain the reason why you're here today?
So I got a cut on my foot when I was walking my dog.
Okay.
And I didn't think anything of it. I thought it was just going to close and heal. But it's been smelling really bad. It's turning black, and I thought it was dirt. But it's been slowly getting worse.
Okay. When did you first notice that this happened, or when did that cut happen?
About a week and a half ago.
Okay. So we'll say 2 weeks. And you just stubbed your toe on something. Do you know what it was? Was it like wood, metal?
No idea.
No idea.
There was a cut there. I noticed.
Okay. Have you had any tests performed on this injury?
No.
Are you taking any medication specifically for this wound? No. Okay. Is your wound painful?
Yes, very painful.
Okay. On a scale of 0 to 10, could you rate that for me? 0 being you're feeling all right, 10 being the worst pain. Take me to the emergency room right now.
It's about an 8 or 9.
Okay. Does the pain change with any of the following? Elevation, activity,
elevation, basically everything.
Okay.
It hurts.
Okay. Is there anything currently being done for your wound? You're not taking care of it at home or anything. And you said it was getting worse.
Mm-hmm.
Okay. Have you had any other wounds like this in the past? Okay.
Okay.
Very good. So now we're going to move into like our assessment part where I'm actually going to assess you because I'm actually going to have you lean back there. We'll bring your feet up there. Okay, so what I'm noticing in my observation is there's some sloughing here, this yellowish part, and I'm noticing that there's black toes. I think that's due to the necrotic tissue, and it's localized gangrene. It looks like on the 4th and 5th digits. above the PIP and DIP joints. So on a Wagner scale, I would give this a grade 4 just because of the localized gangrene and there is some odor. Now I'm going to go ahead and take some measurements. Okay, so we're doing the top measurement. So I'm going to go from the head, which is the longest part. So 3 centimeters and 3.5. So to get the circumferential measurement, we would do the length times the width. And now we're going to do sensory assessment. Okay. So I'm just going to ask you to go ahead and close your eyes. We're going to do a sensory assessment, which is feeling like the different types of feelings. So we're going to test for pain and we're going to test for like a dull as well. So if you could close your eyes for me. If you could close your eyes for me, thank you. So I just want you to tell me if you feel this, okay?
Mm-hmm.
Do you feel anything now?
Yes.
How about now?
Yes.
Did you feel anything now?
No.
Did you feel that?
No.
Could you feel this?
No.
What about this?
Yes.
Okay, did you feel anything now?
No.
Okay. Did you feel anything now?
No.
Did you feel anything now?
Yes.
Anything now?
No.
Did you feel anything now?
No.
Did you feel anything now?
No. Yes.
Did you feel anything now?
Yes.
Anything now?
Yes.
Did you feel anything now?
No.
Did you feel anything now?
No.
Okay, very good. Alright. Now we're going to do range of motion. So I'm going to assess you using the goniometer. It's just a way for me to check and see how well the joint is moving. I'm just going to assess the ankle joint, okay? So the first test we're going to do is I'm going to have you put this under you. Okay. So we're going to start with your foot right there and neutral. Okay. And I just want you to go ahead and bring your foot up as far as you can towards your butt. Okay. Good. And let's go back here. Now I want you to bring your foot down towards the ground. Good. Okay, and we would test the other side first, just for the purpose of this video. I'm not going to test it for time's sake. And then now we're going to do manual muscle testing. So the first thing I'm going to have you do, okay, I want you to bring your foot towards you, okay? And I want you to hold it there and don't let me pull you down. Good. Alright. And we would test bilaterally. Now I'm going to have you stand up for me. And you're going to go up on your one foot at a time. You're going to go up on the good foot first, since you're standing, you can do that. Good. All the way up on those toes. Good. As many times as you can.
That's all I can do.
That's all you can do. Now let's try it on the other foot. Okay.
You got one.
Yeah, so that's, okay, you can take a seat. So that shows me right there that you have a little bit of diminished strength. And so we'll work on the strength as well, okay? Also now I'm going to test for your pulse. So I'm going to come down here. Good, I feel that. Let me just test the other side. Okay, let me test So for the right foot, which is the foot showing with the injury, I would give a 1+ for both the dorsopedal and the posterior tib because they are diminished compared to the other foot. As far as the description of skin color, I would say that you have the black toes, which I said is basically the necrosis.
What is necrosis?
Necrosis is due to like lack of oxygen and blood supply getting there, so typically the skin will be blue, dark brown, black because of ischemia. His lower extremity there's no hair on the foot, and his toes are a little yellow, I can see, and his hair is starting to fine as we go up his leg.